Happy Friday, everybody, and welcome to the internet's favorite show about plastic surgery, health, and beauty. This is Nip Talk. We got a great show for you today. First off, is it possible that you could have an organ stolen if you have surgery outside of the country? There's a couple news articles that say that might happen. Next, a plastic surgeon's wife dies from the plastic surgery that he did. And finally, cholesterol and hypertension. There's more risk to young people than we previously thought. We're going to talk about that, and it's coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk. An honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
What's up, everybody? Thank you so much for joining us. We really do appreciate it. Please hit that like and subscribe button. It helps us so much. I'm your host, plastic surgeon Dr. Bruce Hermann. With me is the amazing Sarah.
Hi.
In the box, we got Travis. How are you, buddy?
Hey, I'm good. How about you?
Doing good. It's a good Friday. Fridays are always good.
Yeah,
for sure.
And
Yeah.
it's not raining, and it's abnormally
I know.
warm.
I think isn't it supposed to rain this weekend?
Yeah, but it's like abnormally warm.
Yeah, I'm running in the
December.
Dallas Marathon on Sunday.
Nice.
Yeah, I'm not doing the full marathon though. I'm doing like one of those relay teams or whatever. And so, yeah, I've done it before with this anesthesia group. They do it for charity, and so they ask people to run. And yeah, I'm pretty excited, but I thought I was gonna be running like 4 or 5 miles, but they gave me, apparently it's not equal lengths for everybody because it would be what, like 5.2 miles, I guess,
Okay.
if it was equal. So mine's 8 miles. Which is fine. I mean, I'm sure I'll be able to do it, but I've been training at 4 miles, and so I don't know. I'm sure it'll be good. But I've been training
I'd
like
be
really.
walking a lot.
Huh?
I said I would be walking a lot if I did a marathon.
I'm sure I can run the whole thing. It's just I thought I was going to be running a shorter
Pace
distance.
yourself. Yeah.
Yeah, I'll just have to pay. Like I was running, so I ran. Yesterday was the last day I ran. I ran 4 miles, but at 8 minutes per mile, which is pretty quick. So I'll slow it down to like maybe 9, and I should be fine. I hope. We'll find out, I guess.
I would die.
But you're in shape. What are you talking about? You would die.
I have no endurance when it
Oh,
comes
you
to
don't?
cardio stuff. Like, I'm so bad at it.
Yeah, you're like a bird. You're like a cheetah, right? Like you just run really quickly, and then you gotta like take a nap for like 5 hours.
Yes. Yeah. But that's like what gymnastics is. And I did
Yeah,
gymnastics
that's
for
true.
so long that we just need short bursts
Right.
of like extreme energy,
Mm-hmm.
and then we're done.
Yeah.
So that's how like I am. That's why I like when I run, I'm like 1 mile's good.
When I was younger, I did a lot of like really short distance racing, like in high school and college. But then like as you get older, like I'm not gonna be out there running 40-yard dashes. You know what I mean? So I just run a few miles just to stay in shape. But yeah, it's been good. Honestly, it's been great because knowing I had this thing coming up, it's really kind of kept me on pace with like running. Because as it gets to winter, it gets dark so early and it's cold and like you just don't. I don't know. I like to run, but I don't like to run if it's like cold or dark.
Yeah.
And
There's a study about. I guess I need to do this next time. but
Yeah, tell me.
It's about.
Give us a preview.
Yeah, it's about how you're supposed to like walk instead of run. Like walking at a
What?
certain pace for a certain amount of time can burn more calories and fat than running can.
So I'd be
As long as you're in, the article was talking about how as long as you can still talk while you're doing this, that's where you should. That's
So-
the pace you should be. You shouldn't go so slow that like you're just walking.
Right, yeah,
Like
it's like
leisure walking, but you should be walking
no
fast
ambling
enough.
or
Yeah, you should be
moseying.
walking fast enough to where like you can talk
Yeah.
comfortably.
So it's interesting you say that, like, because we did do this segment about how taking extra steps can, really
Yeah.
improve like your overall health and help you lose weight. But I found this formula, and I was actually going to talk about it one day. So I have this formula. I wrote it down somewhere, and it basically tells you how many calories you burn from running. But like one of the variables is like your speed.
Yeah.
So I mean, there's definitely there's definitely an advantage to running faster, but then the downside is it's hard on your joints and stuff, right? And so that's probably what they're getting at, is that you can probably get an equal workout from walking if you do it right.
Oh, yeah, and it's at a slight incline.
Oh, well, that makes a big difference too. Yeah, the formula I have doesn't take into account inclines, because that sucks. I did one of these like marathon relays, and I got the leg that was like all uphill, and I was like dying. You know, I just killed. So where I run, I have like one big hill, so I have to go up it, and then so I run 2 miles and I run back, and so it's right at the beginning I have to run up it, and then at the very end I have to go up it again. You know, because you go up and then down, and the hills.
Yeah, I have that in my neighborhood too.
Yeah, the worst.
I went on a run during Thanksgiving.
Yeah.
And it made me feel better about how much crap I ate.
So you guys do anything this weekend? Anything good, or just run-of-the-mill stuff?
No, I'm not doing anything big. I think I'm going to a Christmas party with some of my friends.
Oh, that'll be fun. I went to one last weekend.
That's really it.
Yeah, I think we have something tomorrow night too. Yeah, it's a busy weekend. Travis, anything for you, buddy?
So I'm supposed to be going to a comedy show this weekend.
Oh, really?
There's a rapper by the name of T.I. He does comedy as well.
Wait, the T.I.? Like T.I., or is it like a different T.I.?
No. It's like he's the rapper.
Yeah.
Probably the one that you're thinking of.
Yeah.
So he does comedy. He's going to be at the Improv. And then I'm supposed to go to the gun range.
He's a comedian?
Yeah. He's a rapper and a comedian. That's cool.
He has many hats, I guess.
Yeah.
Well,
Right
I
on,
haven't. I mean, I remember when he was super popular when I was
Yeah.
in high school.
Yeah.
Yeah, I remember T.I. Yeah, he's awesome.
He
Well,
still
awesome.
raps. He just does comedy too for whatever reason. I don't know how they interject.
He probably just likes it, you know? I
Yeah,
mean,
for sure.
he draws the crowd, so.
For sure. And I'm going to the gun range. So.
Oh, are you?
Yeah, I'm excited to go to the
Dude,
gun range.
we talked about this in the past. Someday we'll have to go together, because I have all kinds of stuff that we can shoot.
Yeah, for sure. I know we had that conversation.
Yeah, I have a membership at the place by my house, which I don't go to as much as I should, but
Yeah.
that'll be fun.
I
Cool.
love the gun range.
Yeah, right on. We'll have a good time.
Absolutely. Appreciate
yeah,
it.
be safe. All right, well, let's jump into some topics here. The topics are all serious today.
I know.
I'm sorry. It's what was in the news, and I mean, they're interesting topics. So the first one, actually, Dr. Tiffany Moon, who was here last week, sent me
Yeah.
the first topic, which was really
Super sweet.
yeah, that was nice of her. Oh, besties. And she did, when she sent it, she's like, hey, take this with a grain of salt, because she found it on social media. So this is basically a segment about, is it possible that you could have an organ harvested if you go out of the country for surgery? And
Like on purpose or accident?
no, on purpose. Like they steal it to like a
Ew.
black market organ. Right, okay. So she sent me this video. So I'm just going to go ahead and roll this video, Travis.
Oh, video. Got
Yeah.
you.
You like that?
A group of women went to Turkey again, either to get implants or get them removed. Essentially, a group of moms went to Turkey. They go, surgery ends up taking a little bit longer than normal. Everything's fine. They come back home, and then one of the moms started having a lot of back pain. So they do, I want to say they did an MRI. She had one less kidney. She had one less kidney. They checked the other girls. One less kidney.
So basically, as you heard from the little segment there, they were talking about these women that went to Turkey, which is really, really popular for plastic surgery tourism, as I think we
I
talked
had no
about
idea.
that. Huh?
I didn't know that Turkey was
Oh, yeah. So
popular.
Turkey is like the place that people from Europe go to really commonly. Like a lot of people
So
from
it's
the
like
So it's like
it's
going
like
to
America's
Mexico.
Mexico,
Yeah, it's going to Mexico, yeah. And so, you know, the story sounds kind of unbelievable. And mostly, honestly, because I'm thinking like from the standpoint of the incisions, I mean, you can't get a kidney out from an incision on your breast, right? And so, I mean, I think even somebody with no, medical knowledge would realize that they had incisions in places outside of their breast. So I was a little skeptical about that one. And so of course, what I did is I get on the internet, start looking for news articles because, I mean, I'll believe anything these days. And we've talked about some crazy stuff that sounds unbelievable. So, I
Yeah.
mean, you never know. Maybe there was somebody harvesting organs in Turkey for the black market. So I found another one too. I thought I had found it. So I found, and this is just a picture of the video. Throw this one up there, that next one, yeah. So this is basically a YouTube video about this girl talking about her friend who went to the Dominican Republic for a tummy tuck, and she ended up losing the kidney. And I
Why
was
does
like,
it show her butt?
I think she got like a tummy tuck and a BBL or something.
Oh, okay.
So I don't
I'm
know.
sure that was just for clickbait.
Yeah, probably so. And so I was like, well, geez, now there's two of these things. So I did like a pretty thorough like search of like real like news, outlets, because if that happened, I mean, it surely would hit like a news, like a reputable news outlet, right?
Yeah.
Because I mean, the first one was like somebody's podcast, the second was a YouTube video.
I feel like it would be like one of those like CDC warnings, like
Right,
hey,
yeah,
like
yes.
they're warning us to not eat cantaloupe.
You're right.
Like you need, like, hey, maybe not go to Turkey because you're gonna
don't
get.
eat cantaloupe. Don't get your organs harvested.
Yeah,
I mean,
like,
yeah, no,
we
I
need
get it.
those types of text messages.
So, I mean,
CDC.
I was a little dubious on the first one just because of the fact that it was a breast surgery and they said they took an organ. The second one's a little bit more believable, but I couldn't find anything like, anything that was credible about it. So I kind of think that both of those are actually false, that it didn't really happen, but
Something shady.
well, I thought it would
Must
be
have
worth
happened.
at least talking about, like, is it really possible? I mean, could it really happen that someone could steal your organs without you knowing? I mean, it's kind of interesting to talk about. And
I guess if you're expecting only incisions to be on your front, and then you realize, like, after you've already like gone home, that there's like an incision on your back, I guess. Is that where you would take a kidney out? It would be on the
well,
back?
there's multiple approaches for taking out a kidney, because that's a very smart thing to say, is like, okay, well, are the incisions in the same place?
Yeah.
I mean, theoretically, you could get the kidneys through the front. I mean, a lot of times, most of the times these days, I think it's done laparoscopically, which would be more of a backside approach. But yeah, I just want to kind of talk through it, because I've actually done organ harvests back when I was in general surgery. I worked through transplant, and so I have like some knowledge of this. I'm, not that I've ever tried to steal a black market kidney, but like I have knowledge of like the surgery, so I can like talk about it. But so the first thing that I was thinking about is, when you go to get an organ, I mean, you can't just take an organ out of you and drop it into me or vice versa,
yeah.
right? Because with
you have to, like,
organs,
know your blood type and all that kind of stuff.
yeah, exactly right. So you have to match blood type. Then you have to match the cross match, so like the positive, negative. And then there's the human leukocyte antigen, which we abbreviate as HLA, which are basically alleles in your genome, which kind of tell it identifies you as you, right? Yeah. And so it is theoretically possible that you could find somebody that had a perfect match, like a twin. A twin would have a perfect match, and it's possible that out there in the world there's a perfect match. But theoretically, especially with kidneys, you don't have to have a perfect match, because there are immunosuppressive drugs which will suppress your body's desire to reject an organ that's not yours. But it does like throw a wrinkle into it, right? Because there wouldn't be some place out there that just is randomly harvesting organs, because I mean, the chances of them harvesting a random organ and it being a match for somebody in that country is not high. I mean, the number of matches that are out there is in the thousands, 10,000s, right?
Yeah.
So, that just doesn't make sense. So
I feel like if you're gonna do black market stuff, I feel like organs is not the best choice.
I would agree with that. It's just a little bit too complex, because the match thing is it'd be one thing if you could just drop kidneys into whoever you wanted, right? I mean, then I could maybe see that there would be a market for it, but
And then there's probably only so long they last.
Yeah, absolutely.
Viable.
Yeah, 100%. Yeah, you got to put them on ice, and I can't remember exactly with kidneys, but you want to do them, within 12 hours. I think 24 is the max if you put them on ice. Because we would harvest in other states and then bring the organs back on a plane, and then you go to the hospital. I mean, hours go by when you're doing that. But you have to think about that. For black market kidneys, someone's got to pay for that kidney, right? And you would assume it's like some shady person that needs the kidney transplant, right? So there's not going to be this huge number of people who would potentially take a black market organ.
Yeah.
Now, is it possible that there's people out there with money that would try to get a black market? I mean, yeah, it's possible. But then you have to think about, okay, how many people would have to be in cahoots to pull this off? I mean, the surgeon would have to be in on it, all the people in the OR, the people making the match. So suddenly it becomes a lot more complex to actually pull this off, you'd have to have a lot of people that knew about it, which increases the chance that...
Probably like the entire facility that you.
I mean, you would think so. And then the question is, could you theoretically harvest an organ without someone's knowledge, right? Because I mean, you're not just gonna, they're not going to just kill these people. I mean, that's too obvious. They're going to try and take the organ, and like with kidneys, since you have two, and realistically, I mean, you can be fine with one kidney. I mean,
What else kind of organ can you take?
You could do a partial liver transplant. There's living liver donors. I don't think they do living lung. I'm not 100% sure on that, to be honest. Kidneys and liver are the two big ones where they do living donors. Like you could donate one of your kidneys to somebody and live a totally normal life. You could donate part of your liver to someone and live a totally normal life. So is it possible?
No other organ?
What's that?
No other organs?
Well, the only things they really transplant, they do hearts, which you can't really.
Well, you can't survive. Like what? Yeah, like what could you survive in like? You
Like
know what I'm saying?
pretty much
Just
kidney and
liver
liver.
and-
I mean,
okay.
they do pancreas transplants, but I don't think they do partials. They do lung transplants, but you wouldn't want to take someone's lung out. I don't think they do partial lungs. Not that I've heard of, but I don't swear to that because I never did a lung transplant. That was done by different teams.
Yeah.
But anyway, yeah, I mean, it's just the question of could you get an organ out with somebody knowing? I mean, the answer is yes. I mean, you could do it. I think the easiest way would be to have it if you were doing like a big tummy procedure. You know, you could then open someone up internally, go that approach to get the organs, or flip them over and harvest it, and then the pain would be very similar because you're operating on the same area. And I think that you could actually pull it off and then recover and go home and not know it. But kind of like the biggest thing about, is this really a possibility, is, I mean, eventually they're going to find out, right? At some point in their life, they're going to get a scan or an x-ray, and someone's going to be like, hey,
Yeah, their general doctor's gonna
Yeah.
be like, you didn't tell me you had one kidney.
you're missing a kidney. and also, too, a good scan like a CT or MRI, you could easily tell that it had been harvested and not just they were born without it. Because it is possible to be born with one kidney. I mean, generally, then they're more in the center. But theoretically, you could be born with that. But a good scan would show the scarring, from where it was harvested, and maybe clips where they clip the different vessels and stuff. So, I mean, you have to believe that eventually the person's going to find out, and then the place where they had it done would come under investigation. And so, to me, it's just kind of unbelievable because, I mean, you have to have a surgeon doing it, right? I mean, surgeons make good money no matter what, country they're in. And so I just don't see it really being a thing that would realistically happen. Yeah. Like, could you do it? Yes, you could. I mean, these patients that go to these, these on medical tourism jobs, they get blood work. Yeah. So they could test for the HLA, they could test for blood type, all that, unbeknownst to them. They could potentially find a match for a donor, and they could potentially harvest the organ without the patient knowing. But I don't think that realistically they could just pack up shop and disappear, which is what they would have to.
This should be like on Dateline if it was real.
Yeah, I mean, it would be a heist of like grand proportions to pull it off and then to get away with it, because I mean, if you find out that they took your organ, obviously you're going to be like calling the local authorities, and these countries don't want to scare off tourists, and so you would think they would go after a place that was doing that, and I just don't think that it's real. I mean.
Fake news.
There's just too many. There's too many roadblocks to actually pulling it off.
Yeah.
So could it be done? Absolutely. I firmly believe that theoretically it could be done.
Yeah.
Has it been done? Nah, probably not.
Yeah.
I just don't think so. But it's interesting to talk about. I mean, when I saw that video, I was like, oh, maybe. And then I saw the other one. I was like, geez, is this like a real thing? Like, is this actually happening? But like I said, I couldn't find any credible. I couldn't find any credible documentation. I mean, you couldn't even find like a patient's name, right?
Yeah.
I was like, okay, give me a name and I'll Google that name and surely it'll pop up. And no one ever said, it's always like, oh, my friend's friend or my mom's, next door neighbor.
Like an
or whatever.
urban legend thing.
Yeah, I think it is an urban legend. I do. Like, you always heard, I don't know, growing up, we used to go to Mexico all the time, and you'd always hear those stories. Oh, the person went to Mexico and woke up with like an incision on their back and in the bathtub and all this stuff. And I mean, I'm not sure that that's like an urban legend. I just don't think it's real.
The new Saw movie, kind of.
I haven't seen it.
Like touching on kind of this, but
Oh, really?
It's not necessarily organ harvesting. They tricked him into thinking that they were going to like take out like an organ of his that was like cancerous. And they actually didn't take it out. They like you could see them performing the surgery on camera, like he was awake when they were performing it.
Oh wow.
Yeah, you could see them performing the surgery on camera, but it was actually like a video.
Did it look real?
Yeah, it did.
It did.
But everything was a ruse. Like,
it was fake.
Yeah,
okay.
from the doctor to the person
Oh,
who
wow.
drove him from the airport. So it's so funny that you were like talking about it because it kind of is like something that's mainstream.
That's the new Saw movie.
That's the brand new one.
I saw one. I didn't finish the series. I tend to get lost when movies go past like
I
2 or
only
3.
watched
for
the
sure.
first one.
But anyway, it was interesting to talk about. I do think it's something that theoretically could be done.
For sure, yeah.
Realistically, I don't think it's being done. So, but I'm gonna keep an eye out and see
Yeah.
if I see any more stories.
Please.
And thanks, Dr. Moon, for sending that to me. I do appreciate it. It was very interesting to like look that up. So.
For sure.
All right, let's move on. This story is super, super sad. This one just came out. It happened, it happened this past month, and it's about a woman whose husband was a plastic surgeon, and he was doing surgery on her, and she died from it. And
Like in surgery?
she went into cardiac arrest during surgery and died a few days later. She didn't die in the surgery, but so this happened in
Florida.
Gulf Breeze, Florida. The lady's name was Hillary Brown, 33 years old. Her husband's Dr. Ben Brown, like a pretty well-respected, board-certified plastic
They look
surgeon.
like a cute couple.
Yeah, I mean, totally normal. Like, I mean, this is just, it's not
She
like,
did it on purpose. I'm just kidding.
well, I mean,
Allegations.
I don't know.
It is Florida.
So basically, the woman was having surgery after hours at her husband's office, and she went into cardiac arrest. She was transferred to the hospital and later was pronounced brain dead, and they took her off life support like later in the week. And this just happened like a couple weeks ago. So they're under this thing's under investigation, and I don't think it's under investigation because they think that anything like purposefully happened. I don't believe that.
He wasn't following correct procedures.
Yeah, they're checking just to make sure there wasn't negligence. I believe.
Yeah.
Now, I don't know that. I mean, I looked through multiple news articles because this is all over the news, and so I looked at a bunch of articles about it, and it didn't seem like that they were concerned that he did something purposefully.
Yeah.
Right. But I did want to talk about it because there are, and as I always say when we talk about these sad things, like we're not sensationalizing this lady's death at all, but there are some things that can be learned from it to potentially protect, other people.
I already know one.
Huh?
I already know one.
You probably do. So the little bit of detail. So I got this from all the news articles. She was having multiple procedures.
Yeah, that's not good.
One of them was a fat transfer. So I would assume it was a Brazilian butt lift. It didn't say that, but that would be the obvious one. The patient had multiple seizures in the OR before she went into cardiac arrest. In the 911 transcript, it was stated that the doctor possibly over-medicated the patient. Okay. The doctor stated that he used a different medication due to the regular medication being unavailable. So all of that to me points that they were doing surgery under local anesthesia. Now, that was not stated anywhere, but all of those things kind of fall in line because local anesthesia toxicity, the most common thing is central nervous system problems, one of which is seizures. I mean, that's kind of the classic, serious complication from getting too much local anesthesia is you have a seizure. Also, when they were talking about the medications not being available, so we do like really, really minor stuff in my office where we use lidocaine, and we can't get lidocaine right now. Like there's a national back order. So that also kind of makes sense when he mentioned, the medication we normally get, we couldn't get because I know that there's a national back order on certain local anesthetics. So I want to kind of just talk about a couple points about this case because at the end of the day, a lady, lost her life in something that should be overall extremely safe. And so, is there something, and not to say that, they did something, wrong, but is there something to be learned from this? So I want to talk a little bit about local anesthetic toxicity. So local anesthetics, lidocaine, Marcaine, Novocaine. I mean, you've always have all had that at some point in your life,
The
right?
dentist.
Yeah. They stick a needle, they inject you, it goes numb, right? Yeah. And so we've talked about people doing big surgeries under local in the past, which I'm not a huge fan of, and I'll talk about that in a minute. But how does local anesthetic toxicity happen? Well, there's two obvious ways. One, you can accidentally inject that local anesthetic into a blood vessel.
Okay.
So instead of injecting it into the tissues to make them numb, you actually need to go into a blood vessel and you inject it into the bloodstream. And just like every other medication, if you inject something into your bloodstream versus another route, like the bloodstream is the most potent.
Yeah, your body just like
Right,
absorbs
instantly,
all of it.
instantly it hits you. The other way is they could have accidentally just overdosed her. When they talk about, we didn't have like the normal medication, it's possible, like we tend to use 1% lidocaine, but they have a 2% lidocaine. So it's possible that they got like a different strength of the medication, and perhaps somebody mixed it up and didn't realize it was a different strength.
And honestly, I feel like because it was almost like she was a regular. And you know how like...
It did say that she'd had multiple surgeries by him.
Yeah, and then obviously the wife of the surgeon. It's almost like she's just like a regular showing up to the bar, And it's just like you don't have to pay like super, pay
you always
attention
wonder.
to them,
And it could be either way, right? It could be that it's the boss's wife. You
So
got
they
to
were, like,
really pay
overly
attention, or maybe it's like the boss's wife and
laid
she's
back.
really familiar with them and they're
Yeah.
joking around. I mean,
Yeah,
who knows?
like I could see that being the issue, like too laid back, not following all the checks and balances when it comes to the procedures.
It could be.
With that.
I mean, I don't know. I didn't say anything like that, but the other way that you could potentially overdose with lidocaine is if they're dosing you for lidocaine that has epinephrine, but it didn't have epinephrine, because if it has epinephrine is put into lidocaine because one, it constricts blood vessels and you bleed less, but also it increases the amount of lidocaine you can give, because it's less likely to get out into the bloodstream if you use epinephrine. So say, for example, like they had a stronger concentration and maybe it didn't have epinephrine, then even using an amount they were used to could potentially cause a toxicity. So like, what is there to learn from this? Because at the end of the day, like we don't want to talk, about some lady's death in just a flippant way or just to, for clicks. I really am kind of against people doing major surgery under local anesthesia. And I've done surgery under local. I mean, it's not that I'm not familiar with it or haven't done it. I have, and I just don't like it. I mean, I've done it safely. I've never had anybody, have like any kind of significant complication from it. But having done it myself, I can absolutely see how it could happen. I mean, if you're doing something under local anesthesia, you have to get perfect anesthesia. Like if the patient's like in pain, it then makes it more dangerous because they're moving. It's a moving target, and you could potentially cause an injury just because they're not, being still. So then you're obligated to give these larger amounts of local anesthesia because you have to have the patient be comfortable.
Yeah.
And also, she was having multiple procedures, which to me is a little bit of a red flag. And who knows what that means? I mean, maybe she had like something really small and then also this other procedure, and they're saying multiple. But it would be unwise to do multiple large surgeries on somebody using local anesthesia.
Yeah.
You're going to bump up against the toxic dose. It's going to happen. I mean, I know this because like I said, I've done some surgeries. I really don't do them anymore just because in this day and age where I'm pretty busy, I can pick and choose what I want to do, and I just don't want to deal with that.
Yeah, it's like, even though it's like you can do it, but it's like, should you?
Right,
be doing that?
exactly right. No, totally.
And like, I feel like whenever you're talking about like the local anesthesia and versus like going to a surgery center and like actually having it, it's almost like it's another, I can do that, but should I?
But should I? Totally.
But then it's like, I feel like the surgery center is just like a safety net. Like we're doing everything possible to make sure that you're safe and that we're doing what we're supposed to do.
And I'm going to talk about that too. And finally, my big issue with surgery under local, outside of just the safety issues, is just the comfort issues. I mean, I did 2 breast augmentations under local many years ago, just really to see if it could be done. And I did them, and they both went fine. One patient sailed through it. I mean, it was so easy, like it was not really that hard. the next patient was like in discomfort. I mean, not like so much that, you know, she was mad about it, but like she had a rougher time doing it. So you get this big variability in how patients can tolerate this.
My augmentation was definitely done at
Yours was done at a local?
I'm pretty sure it was. Like, I didn't go to a hospital. I went to like a office building.
But you were awake for it?
I mean, I wasn't awake. No, he put me to I was asleep.
Oh, then they put you under anesthesia.
Oh, okay.
Yeah.
But I like went into like an office setting.
Well, you can still do anesthesia in an office.
Okay, cool.
Yeah, totally.
But yeah, no, I wasn't awake. You can do that when you're awake.
Yeah. They were
you're
wide awake when I did it. Yeah. That's the whole thing about local anesthesia. Like, you're awake, like you're not knocked out. Like, that's the whole thing about it.
Okay.
Sarah, bing.
Well, I thought whenever you would say like surgery center, going like in surgery, I don't know why I never thought like they were awake. I thought, because I know that we've seen those videos of like being awake.
Now they may
doing,
have given them like a
liposuction.
Valium or something, but like they're not like under like a general anesthesia.
Yeah.
Yeah, for all intents and purposes, awake. My other kind of concern about this, and you know, this will probably annoy some plastic surgeons. I'm not a huge fan of like surgery in the office. I personally use a surgery center. At one point in my career, I thought about doing like an office OR, and I ended up not doing it. I'm happy I didn't. But as a patient, you have more protection in a surgery center.
Yeah.
There's more oversight. There's more resources. I mean, if this lady had had a seizure in a surgery center, even if they were doing something that are local, they could have intubated her and put her on life support, and she wouldn't have died. I mean, they would also have had the IV lipids, where that's the reversal for local toxicity. They would have had that there most likely. So, you know, the fact that this was done in an office, like it absolutely, you know, has some contribution to the outcome.
Yeah.
And so, you know, I mean, and there are plenty of great surgeons who do surgery in their office and they do it safely, but it's just one more potential way that something could go wrong. And we've talked about different news articles where like a doctor did something in their office OR, and like the guy who didn't call 911, like that would never happen like in a surgery center.
No.
Good, because there's too much oversight. So the other two things about this one, multiple procedures. I mean, they didn't really say what multiple procedures were, but you know, I'm not a huge fan of like doing too much surgery at once. I mean, it just opens you up to risk. It may have contributed to this if they were doing multiple procedures with local. I mean, that absolutely could have contributed. And then finally, you know how I feel about BBLs. Like,
Yeah.
I don't think that BBL her symptoms don't sound like a fat embolism, which is the one that whenever we talk about BBL deaths, is.
I'm just like trying to figure out why would somebody want to be awake doing that?
I don't know. I mean, I just don't know. Like, if my wife,
Unless,
even if,
like, I guess there's some people that are scared to be put to sleep.
it's so much safer. Even if like I was doing local anesthesia surgery, I wouldn't do it on my wife. There's no way I would do that. You know?
How like nerve-wracking too. It's like when your wife is like watching you cook or something.
What, to do surgery on them?
Yeah.
I mean, I've operated on all of my family members. I mean, they say you really shouldn't do like life or death operations on a family member, which I kind of totally agree with. Obviously, what I do is not really life and death these days, but yeah. I mean, I feel bad for everyone. I feel bad for the guy. I mean, because, you know, I mean, he's got to live with that the rest of his life, which
I wonder
horrible.
if he'll continue his business.
I don't know.
I did think about that though when you
What's
first
that?
like brought up the story. Like, is it probably like frowned upon for him to like be doing that like on his life? Just because if something happens, you kind of go into a more emotional state than a critical thinking state.
So I've operated on all my family members, and maybe a lot of it's because I'm kind of grandfathered in, where like I started in a time when it was still not that big of a deal to do it. Like some hospitals won't allow you to do certain surgeries on a family member because if they were to have like complication, they feel like you wouldn't be able to think clearly.
Right.
Which, I mean, I kind of get that. I mean, but once again, I don't do life and death surgery anymore. So, you know, I mean, I literally operated on my wife, both my kids, my mom, my brother. I mean,
would you be able to operate on me, Dr. Herman? And if something started to go wrong, you would be able to critically think, or you would emotionally think? Okay, all right, for sure.
Yeah.
I trust you.
Dude. What are you looking for, man? Are you in the market?
I want like 2 more dimples. like above the ones I currently
Are you sure you don't want elf ears?
Yeah, I'll take that too.
I thought you were about to say something serious. I was like, what's
Whoa,
happening? What do you want?
No.
So, well, anyway, so it's a super sad story. Our condolences to her and her family and all of that. It's really sad. I'm gonna kind of keep an eye on that and see.
Very scary.
I don't think anything's gonna come up that's gonna be shocking. I think it's gonna come out that it was a lot,
An accident.
an accident, and then that's the end of it. But yeah, it's really, really sad. So, all right, let's move on to the final one. This one's not quite as serious. It's kind of interesting though. Travis, this one falls into your age bracket. Well, you too. I'm unfortunately out of the age bracket. I'm too old for this article. So this article's for you guys.
Got you.
So there was a paper that came out just recently in the Journal of the American College of Cardiology, and it was talking about young adults. So that would be like the 20 to 40 range. Because like in the past, it wasn't always thought of that, hey, I need to test or treat a young adult for either high cholesterol or high blood pressure.
Okay.
It wasn't, and I'm not like a primary care doctor, so I'm just kind of giving the general feel. And also from reading the article, it kind of said that okay, we haven't been testing young people for these things. We haven't really been treating them because the belief was that things like high blood pressure and high cholesterol are only a risk as you get older, right? Because it's old people that have heart attacks, old people that have strokes for the most
but
part.
it's from learned behaviors that they learn as a young adult.
That's
have those issues.
Yeah, I mean that's absolutely true. So, so this study was pretty interesting. It had 4,000 people aged 20 to 39. It was looking at the risk factors that they had and the amount of atherosclerosis. So atherosclerosis is fatty plaque buildup in your arteries.
Okay.
It's probably the biggest risk factor for having a heart attack or stroke. If you have plaque buildup in your arteries, you are at risk for heart attack, stroke, without question. And so when they looked at this, they found out that young adults are much, much more vulnerable to get atherosclerosis than I guess these investigators thought they were,
okay.
Which is interesting because I remember, it's funny the things you remember from like school and for me, like, med school. I remember when we were in one of our med school classes, they told us about a study looking at the Vietnam War, and they were doing, I guess, autopsies on soldiers who died. Mm-hmm. And I don't even know why they were doing the autopsies, but the only thing I remember from the story is that they were shocked to find that they had some 18-year-olds, 20-year-olds that had plaque buildup already. And I was like, wow, that's really crazy to be that young and have plaque in your arteries.
Yeah.
And I didn't really ever think about that story ever again until I just read this and I remembered it. And so the study basically said that young people, 20 to 40, are much more vulnerable to plaque buildup from high cholesterol and high blood pressure than we thought.
Okay.
And also more importantly is that if you get that plaque buildup, it's actually possible you can reverse it if you change your lifestyle.
Right.
And it happens more when you're young versus old. Mm-hmm. So like if you're 75 years old and your arteries are just chock full of, cholesterol plaques or atherosclerosis, you're not going to really be able to reverse that. You're going to have to do surgery to take out the plaque or
get one of those,
yeah,
like an implant of some sort.
Yeah, right. Like, protect yourself somehow from having a heart attack or stroke. But young people, it was showed in this study, can actually reverse atherosclerosis if they treat their high cholesterol and high blood pressure. And so, the kind of the take-home study of this, and this is going out to young people who are literally the worst about going to the doctor. I mean, I'm even really bad about that myself. Yes. But if you're conscientious about your health and you want to do everything possible to live a long, healthy life, then this news is kind of important that if you do have high blood pressure, if you do have high cholesterol, it really is very important that you start treating it now and not when you're like my age.
Yeah. Yep.
And so I know we've talked about cholesterol in the past, but I just want to briefly kind of go over, well, this is cholesterol and hypertension, how to make those better. Mm-hmm. And so a lot of them are very simple, like exercise, right? If you exercise, your LDL, which is bad cholesterol, goes down, and your HDL, which is your good cholesterol, which actually pulls fat out of your arteries, goes up. So exercise is good. Smoking, avoiding smoking is really important. Smoking is very, very bad for your blood pressure. It's bad for your arteries. It causes them to constrict. It causes them
It's the worst, yeah.
Yeah, smoking's really bad for you. I mean, I'm one of those people where I'm not gonna like chide people about things they do. You know, I'm just kind of like a live and let live kind of guy. But like smoking is super bad for you. Like if you're smoking, you're seriously impairing your health.
Yeah.
Decreasing refined sugar intake
Okay.
has been shown to help with cholesterol and hypertension. Decreasing saturated fat intake. I think we've talked about that. We've been doing this show so long
Fast
now. It's
food.
like every time we do a topic, it's like, oh, we talked about that.
Facts.
Limiting your alcohol intake. Yeah, I know, right? Dun, da, da, da. You know, you want to be sparing with alcohol because a little bit of alcohol has been shown to potentially be beneficial to your heart, but there's like a quick reversal in that when you drink a lot, either a lot frequency or amount at
Yeah.
one time. Stress management's important, you know, making sure that you're not overly stressed. Weight maintenance. You know, people that are heavier are more prone to have high blood pressure and high cholesterol. And lastly, the thing that you can do, which, you know, not everyone wants to do, is take medication.
Yeah.
It was funny, when I was in residency, there was a guy who was a really smart dude, and I guess we were like in our 20s at that point. I was 27, 28. And he was taking Lipitor, which is the HMG code, what do they call? Oh, statin drugs. And I was like, dude, why are you taking that? And he's like, well, there's studies out there that show that if your cholesterol is low, even when you're younger, that it's better for your health. And I'm like, interesting. And he's right. I mean, he's absolutely right that there are a lot of studies to show that lowering your LDL can improve your lifespan and decrease the risk of heart and stroke. And I'm not doing it personally. Like, I've actually thought about it. I mean, I've checked my cholesterol though lately because I run. Like, my cholesterol is pretty good. You know, I mean, it wasn't great a couple years ago, and I was kind of taking off because of COVID, but mine's actually pretty good. So I haven't actually started a statin drug, but I've thought about it.
Yeah.
You know,
My family is like riddled with
I remember you telling me that.
cardiovascular disease.
You should
and
honestly
stuff.
like go. Do you ever go to the doctor?
Yeah.
Okay.
Well, girls go to the doctor more. I mean,
Well,
we have to
right,
go to the lady doctor. Like
yeah,
every
but like
year.
they're not checking your blood work, are they? Or are they?
They can.
Okay,
If they'll ask if you want to do
Oh,
blood
do
work
they?
and stuff. Yeah.
Oh.
'Cause
Yeah.
a lot of girls treat their OBGYNs like
Like
their-
primary care doctors, yeah.
But yeah, I have blood pressure. High blood pressure runs in my family. I have naturally high blood pressure. My oldest sister does too. I think she takes high blood pressure medicine.
I bet your cholesterol is great though, because you exercise so much.
I'm sure it is, but like
Yeah.
I think it's my inability to. I think I have high blood pressure because I have so much, like, I stress myself
Stress
out.
related, could be. I mean, stress
Yeah.
100% can raise your blood pressure.
Yeah, because
Yeah.
I had to take high blood pressure medicine when Avery was like 2 and I was trying to go back to school.
Yeah.
I had to take
Really?
blood pressure medicine,
My-
for like a month.
Yeah, my
because
wife had to take it
doctor
for
made
a
me.
while, and then I think she quit. I don't know, I can't remember. She was taking. It made her really sick, so she
Yeah.
quit taking it.
I didn't want to take it because I was like, I don't want my body to depend on this. Like,
I
wanna
know,
fix
right?
it
You don't want to be
myself.
dependent on medications, but at some point, like
Yeah.
you may have to, just
Yeah, I'm like, I wonder if I should just take anxiety medicine. If that would be better. But speaking of military, whenever my ex-husband came back from Afghanistan,
Mm-hmm.
he had been eating so much saturated food because they were eating like food that was dropped from like helicopters that was frozen, like stuff that's like super like pretty much just like eating fast food or like TV
right.
dinners all
Lose
the time.
cholesterol through the roof.
Yeah, and eating MREs.
MRE.
Yeah. And
Meal ready to eat.
his cholesterol and blood pressure was so bad.
Really?
And I had to make sure that we never, like, I made sure, like, all of our food was, like, fresh or, frozen vegetables. So, like, I stopped buying canned food. We never ate fast food ever.
Wow.
And I made it go down.
Nice. Good
yeah.
for you.
But, like, his was, like,
girl.
out of control.
Good work.
Yeah. Because I remember, like, I was reading, like, going to the grocery store, reading the back of cans.
Yeah.
For vegetables.
I mean, it's important. Like,
Super high sodium level.
Yeah, we
and
talked
that's
about
really
that.
bad for your blood pressure.
yeah, certain foods are definitely better for you, and certain ones are definitely worse.
Stuff that lasts a really long time.
Right. all the preservatives
it's
and
bad
stuff.
for you.
Yeah. Fresh food's always
So-
better, but it's
yeah.
more expensive though. Is the problem.
Yeah.
I mean, that's an issue too. It's like eating healthy can be expensive.
Mm-hmm.
But all right, young people, I'm looking at you two. Take care of yourselves.
Nah, facts.
And I have, it's double for me. I should be
As
doing
I'm about to go to a Christmas party tomorrow where there will not be any alcohol at all.
Oh, not at all. I went to one last
Or
week. There was none.
with saturated fat.
But you, like he said, you work out so much that I'm sure it like balances out.
Yeah, I think, yeah, Sarah, I'm sure you're probably good.
Every time I go to the doctor, my doctor's like, your blood pressure, do you just
It could
go
be
to
white coat syndrome too. Like some people
yeah,
actually.
that's what they said.
Yeah.
They're like,
Right.
it's because you just stress yourself
Right.
out for no reason.
That's
And I was
definitely
like,
a thing. So.
Okay.
All right. All right, everybody. Thank you guys so much for joining us. Please hit that like and subscribe button. Leave us a comment. We want to hear from you. We'll see you next week on Nip Talk.